Want to pass your med-surg, Hesi? Then let's get started. Here are 10 critical thinking questions based on the urinary system. Question 1. A 70-year-old male patient presents with acute onset of flank pain, hematuria, and nausea. Which of the following should be the nurse's first action? Administer pain medication as prescribed, prepare the patient for a CT scan, obtain a urine sample for analysis, start an IV line for hydration. Pause the video and select your answer. If you chose option C, you are correct. Obtain a urine sample for analysis. Obtaining a urine sample for analysis is the first step to identify the cause of symptoms such as kidney stones or urinary tract infections. Question 2. A patient with chronic kidney disease is admitted with hyperkalemia. Which of the following ECG changes is most likely to be observed in this patient? Peaked T waves, prolonged QT interval, ST segment depression, presence of U waves. Pause the video and select your answer. If you chose option A, you are correct. Peaked T waves. Peak T waves are a classic sign of hyperkalemia. Question 3. During the assessment of a patient with nephrotic syndrome, the nurse notes periorbital edema and ascites. What should the nurse include in the patient's care plan? Increase fluid intake, encourage a high protein diet, monitor daily weights, administer antihypertensive medications. Pause the video and select your answer. If you chose option C, you are correct. Monitor daily weights. Monitoring daily weights help keep track of fluid retention, a key aspect of managing nephrotic syndrome. Question 4. A 45-year-old female patient is admitted with pyelonephritis. Which of the following findings is most indicative of this condition? Urinary frequency and urgency, coastal vertebral angle tenderness, gross hematuria, suprapubic pain. Pause the video and select your answer. If you chose option B, you are correct. Coastal vertebral angle tenderness. Coastal vertebral angle tenderness is a hallmark sign of pyelonephritis. Question 5. A patient with a urinary tract infection is prescribed ciprofloxacin. Which of the following instructions should a nurse provide? Take the medication on an empty stomach, avoid consuming dairy products while on this medication, discontinue the medication if experiencing dizziness, drink at least 2 to 3 liters of fluid per day. Pause the video and select your answer. If you chose option D, you are correct. Drink at least 2 to 3 liters of fluid per day. Increasing fluid intake helps flush out bacteria and support the effectiveness of the antibiotic. Question 6. The nurse is caring for a patient with end-stage renal disease who is scheduled for hemodialysis. Which laboratory value should the nurse monitor most closely before the procedure? Hemoglobin, potassium, calcium, sodium. Pause the video and select your answer. If you chose option B, you are correct. Potassium. Potassium levels are critical because hyperkalemia is life threatening and dialysis helps correct it. Question 7. A patient with benign prostate hyperplasia reports difficulty starting urination and a weak urine stream. Which intervention should a nurse prioritize? Encourage fluid restriction, teach double voiding technique, recommend pelvic floor exercises, administer prescribed tamsulosin. Pause the video and select your answer. If you chose option D, you are correct. Administer prescribed tamsulosin. Tamsulosin helps relax the prostate muscles, improving urine flow. Question 8. A patient with renal caliculi is experiencing severe pain. Which of the following actions should a nurse take first? Administer prescribed analgesics, encourage ambulation, apply a heating pad to the abdomen, strain all urine. Pause the video and select your answer. If you chose option A, you are correct. Administer prescribed analgesics. Managing pain is a priority to provide relief and allow for other interventions. Question 9. The nurse is educating a patient with newly diagnosed chronic kidney disease about dietary restrictions. What nutrient should the patient be advised to limit? Protein, carbohydrates, fats, fiber. Pause the video and select your answer. If you chose option A, you are correct. Protein. Limiting protein helps reduce the kidney's workload. Question 10. A patient with a history of frequent urinary tract infections asks about preventative measures. Which of the following suggestions should the nurse include? Use bubble baths regularly, wipe from back to front after bowel movements, drink cranberry juice regularly, delay urination to strengthen the bladder. Pause the video and select your answer. If you chose option C, you are correct. Drink cranberry juice regularly. Cranberry juice helps prevent UTIs by preventing bacteria from adhering to the bladder wall. Click that subscribe button and join us next Monday.